Hello everyone. I'll show you how to use this Picolaser machine. This is the machine's light guide arm. This is the power cord. This is the foot switch. This is the water funnel. And this is the eye shield. It protects the client's eyes before any treatment begins. This is a critical safety measure. These are the glasses. The glasses are for the beautician to wear. Now let's begin installing the machine. The light guide arm must be aligned, like this, with the hole below. Keep it balanced and insert it. After insertion, tighten this nut. Ensure the light guide arm is aligned. With the hole and the nut is securely tightened, tighten the nuts from left to right. This is the light guide arm cable. There's a connector here. Please note this port. Simply insert the cable into this port. Apply slight pressure during insertion. After insertion, twist the nut to secure it. Once the light guide arm is installed, we need to add water to the machine. This is the funnel. This is the water inlet port. Insert the funnel. This is the overflow port. The machine you received will have a label here. Pour water in through here. Once water flows out from here, it indicates the tank is full. After filling with water, cover the overflow hole. Remove the funnel. This is the drain hole. When we need to change the water, unscrew this cap to drain water. Note: use purified water only. After draining, refill with fresh water. Now we'll install the foot switch. There's a socket here. Insert the plug into this socket. Then rotate the nut to secure it. When removing the foot switch, do not pull on the cord. Pulling the cord may damage it. Then plug in the power cord. This Picolaser has high power output. Maintain stable power supply voltage at all times. After powering on the machine, with the plug inserted. After we installed the machine, rotate the emergency stop button clockwise to activate. Twist it from left to right. Also, turn the switch key clockwise to unlock. This is the laser machinal interface. 1060 for nanometers is our most frequently used laser wavelength. This is the 755 nanometers laser, which we use less often. It is typically employed for skin renewal treatments. This is the 532 nanometers laser. It used for removing colored tattoos. 1060 for laser is the most commonly used. This is the energy adjustment. It regulates the laser's energy output. This is frequency. Frequency determines the laser pulse interval. Adjustable from 1 to 10 Hz. Usually to 3 Hz is enough. If you are experienced, you can adjust it to 4 or 5 Hz. Generally, 2 or 3 Hz is sufficient. When testing energy output, we need a black energy test paper. Ensure the laser is directed onto the black test paper to verify normal energy output. This is the most common testing method we use. This is the infrared laser aiming button. I'll now turn off the infrared aiming laser. It is now invisible. For spot removal treatments, we typically use this infrared aiming laser. A red laser dot will appear here. This is the ready button. Pressing it initiates the process. This foot switch controls the laser shot. We will conduct a test. I'm now using the laser to remove the black letters on this paper. During aesthetic treatments, the removal of dark pigmentation confirms that the laser is delivering energy output. Let's test this several times. Laser treatment can effectively remove pigmentation. This proves our laser has sufficient energy. Now I'll explain the practical operation during treatment. Here you can adjust the spot size from 2x2 to 10x10. Rotate this laser probe to adjust the spot size. We also need to change the frequency. The frequency needs to be set to 2 or 3 Hz. For aesthetic treatments, we typically set the spot size to 3, or can adjust it to 4. The larger this number, the larger the laser spot size becomes. A larger spot size disperses the laser energy more widely. For treating large areas of melasma, you can set it to 8 or 7. Now I'll show the actual treatment procedure. Let's set it to 3 for now. Everyone must remember to use the foot switch to control the laser. If you keep the foot switch pressed down, the laser will fire continuously. If you only want to fire one pulse at a time, you need to press the switch once per pulse. For spot removal treatments, I don't recommend keeping the foot switch so long. We need to let it rest for a moment, like this, then continue pressing the switch. For spot removal treatments, we must first position the handpiece close to the client's skin, then slowly lift the light guide arm. Regardless of the treatment we perform, we must start by gently lifting the skin upward from the base. This allows us to locate the most focused energy point, ensuring the laser achieves maximum efficacy. So, based on the client's skin condition, some pigmentation requires breaking the cell walls, while others do not. This requires your judgment. Now, observe here for instance. When removing this dark mole, we gently peel back the client's skin. Then position the laser probe directly on the spot. Shot laser to remove pigmentation. You can see the dark mole has started to lighten. Continuing the procedure will cause slight bleeding and scabbing on the client's skin. When removing moles, slight bleeding and scab formation are essential. After scabbing, do not pick at it. This yields the best results. Gently lift the scab while keeping it close to the skin. At this point, there may be slight bleeding. Look here. This is the optimal result. For mole removal, 2 sessions are usually sufficient. The same procedure applies to spot removal. For example, with the client's pigmentation here, we peel back the skin surrounding the spot. Then shot laser. The pigmentation will lighten, just like this. After a few more laser pulses, the pigment within the spot will be completely cleared. Look here. Next, we'll show you the skin renewal treatment mode. It requires a higher frequency setting. This mode treats the entire face. Set the laser energy to 0.4. Then adjust the spot size here. Push it in firmly and rotate it. Set the spot area to 8. Then we perform the skin renewal treatment for the client. Watch how I operate it. Move gently and slowly. For example, on the nose area, apply the laser probe directly against the client's skin. Slowly move the laser probe up and down. This helps shrink skin pores. For spot removal, the spot size should be adjusted smaller. Set it to 3 or 4. For the skin renewal treatment on the forehead, gently spread the skin with your fingers as before. It can brighten the skin. For treating large areas of pigmentation, we first use a small spot size, with lower energy to remove those large patches. Then switch to the skin renewal treatment mode. Increase the spot size slightly, and treat the entire face. For spot removal treatments, the frequency is typically set to 2. If you're highly skilled, you can also set it to 3 or 4. Then adjust the spot size. The spot size can be set to 3 or 4. We usually use 3 because the 3x3 laser is the most focused. Before treatment, be sure to click this Ready button first. Then, during the procedure, click here to activate the infrared targeting. Place the laser probe directly against the client's skin. The pigmentation will fade quickly. Even for darker spots, they will also lighten rapidly. For this type of pigmentation, laser can be performed directly on the skin. Look here. For darker pigmentation spots, laser treatment is needed to break down the skin, causing minor bleeding. For lighter pigmentation spots, there's no need to cause bleeding on the client's skin. This is likely pigmentation left by acne scars. It can be easily removed with laser treatment. Just like this. The results are remarkably noticeable. For stubborn pigmentation spots, we need to perform multiple shots. For this type of pigmentation, we do not need to lift the laser probe. Otherwise, it will cause the client's skin to break and bleed. For this type of dark mole, we need to slowly lift the laser probe during treatment. And we also need to pull back the patient's skin, like I'm doing here. The pigmentation disappears quickly. Pigmentation in these areas also requires removal. We must clear all pigmentation from the client's face. Then we proceed with full face skin renewal treatment. After treating all pigmented areas, adjust the spot size to 8 for skin renewal treatment. This will make the patient's skin fairer and more refined. The energy for the skin renewal treatment can be set to 0.6. The frequency should be adjusted to 4 or 5. Gently peel back the patient's skin. Press and hold the foot switch. Move the laser probe slowly, like this. After one treatment cycle, the client's skin will feel very smooth. Release the foot switch to stop the laser. Pressing it again will activate the laser. It is crucial to note that during treatment, you must not keep the foot switch pressed for extended periods. Both the machine and your foot need breaks and rest. After undergoing a skin renewal treatment, the client's skin will appear significantly fairer. It can minimize pores and reduce pigmentation. After completing the treatment, click the standby button. Press the emergency stop button, or use the key to turn off the machine.